Okay, everybody, it is Module 12 that we're going to be taping today, and you can watch it on your own so we can make up our time. It's sensory perception, cataracts, glaucoma, macular degeneration, and Meniere's syndrome. The learning outcomes explain the cause, risk factors, pathophysiology of cataracts, glaucoma, macular degeneration, and Meniere's syndrome, describe the therapeutic measures for these, and plan the nursing care for all of these. And we're starting on page 1248 and 1253. Okay, again, page 1248 through 1253 is our text, and we're going to start with glaucoma. Glaucoma is a group of diseases that cause damage to the optic nerve, which transmits visual information from the eye to the brain. The damage is silent, progressive, and irreversible. In the end stages, peripheral vision is lost, and then central vision is reduced, and then the next stage is blindness. The primary consists of two types: primary open angle glaucoma and acute angle closure glaucoma. The primary types are the most common. A second type is caused by infections, tumors, or injuries. And the third type is congenital and developmental abnormalities. Acute angle closure glaucoma is highest among Asians, women over 45, and nearsighted people. And primary open angle glaucoma increases in those over 40, over 50 for European American, and 35 for African Americans. Again, this increases in those over 40, over 50 for European American, over 35 for African Americans, those with diabetes, those with family history, and African Americans are 4 to 5 times more at risk than European Americans. Anyone over 60 or in any high-risk group should have yearly exams. My mother has glaucoma. The actual type, I'm not sure. It's really bad in one of her eyes, and she needed at least 3 surgeries, and currently has a drain to help the fluid drain out to prevent the pressure from rising. But her vision is definitely being affected. Excuse me. With acute angle closure glaucoma, there's a narrowed angle which blocks the aqueous fluid. This is a primary type of glaucoma, and a medical emergency if this occurs. Signs and symptoms: there's severe eye pain, blurred vision, rainbows around lights, eye redness. They might think they're seeing a steamy cornea, photophobia, and tearing. It's typically unilateral, and that means one-sided, and it will result in partial or total blindness if not treated. With primary open angle glaucoma, degenerate or draining system blocks aqueous fluid, gradual and painless. Signs and symptoms: mild eye aching, headache, halos around lights, frequent visual changes. This is the second type of primary glaucoma, and it develops bilaterally, usually gradual and painless, but they may have some aching. When we talk about medications, miotics, these are cholinergic agents such as Isopto and Pilocar to constrict the pupil, and I'm on page 1249. Carbonic anhydrase inhibitors. These decrease the production of aqueous fluid. Beta blockers and steroid drops may be ordered. Mannitol to rapidly reduce the pressure will be used if this is acute. Treatment with drops is lifelong, 2 or more times a day. Sometimes it's difficult to get the patient to comply since they usually don't have symptoms. So sometimes they say, well, it's not bothering me. They don't think about it. Or if it's not bothering me, I don't need the medicine. Also, many of these drops are very expensive. And that's a cost indicator for some people. One of my mom's eye drops is like $60 a month. And should she need more than 3 drops a day, like if it went up to 4 drops a day, that would double. So they are certainly expensive. Also, there's a lack of understanding of the disease and what it takes to control it. Medical alert identification bracelets should be worn in anyone with glaucoma. Contraindicated in acute angle closure. Mydriatics, this is an agent that induces dilation of the pupil. So if you were going to the eye doctor and you had acute angle closure glaucoma and they happen to put the medication in your eye that causes it to dilate like they do on a normal exam, then that could cause blindness. Anticholinergics like atropine, antihistamines like Benadryl or Vistaril are all mydriatics. And the learning tip on page 1249 talks about this situation. With surgery options, when medications are no longer able to control the pressure, surgery may be necessary. For acute, laser peripheral iridotomy. This is non-invasive, using a laser to remove a portion of the iris that allows the aqueous fluid to flow. This procedure may be used prophylactically in a healthy eye for prevention, and for primary open-angle glaucoma, a laser trabeculoplasty, which is a laser that creates an opening in the meshwork of the trabecular. This is something my mom had done, and that causes a flap that the fluid can actually flow from. And that did not work, so she ended up with a like a drain, kind of like a shunt. Another surgery, the cyclocryotherapy, a cryo probe destroys a part of the ciliary network, which helps with the drainage of the mucus. Okay, this is a diagram that shows the flow of the aqueous humor after the trabeculoplasty is done. With glaucoma, there are several nursing diagnoses. You can imagine the anxiety that can go along with the painful kind, or if this is affecting the vision, that can cause anxiety, disturbed sensory perception, pain, self-care deficit, risk for injury, impaired home maintenance, and deficient knowledge. Nursing care for glaucoma, we want to monitor for pain, loss of central and peripheral vision. We need to think about safety and their risk for injury if their vision is impaired. Teach them about the disease and how to manage it, stressing the importance of adherence to lifelong therapy. If they are just on medication therapy alone, that's lifelong. They'll be on these drops for the rest of their lives. 1250, page 1250 talks about how to help people with the medical regimen. And you guys can read that. It is in the first column on the left. Okay, moving on to cataracts. This is opacity in the eye lens, loss of visual acuity, halos around lights, difficulty reading. They're very sensitive to glare, may have double vision, and decreased color vision. Light rays are unable to get to the retina through the clouded lens, affecting the vision. Factors that contribute to cataracts: UV radiation like sunlight, tanning beds, diabetes, smoking, steroids, nutritional deficiency, alcohol consumption, intraocular infections, trauma, and congenital effects that go along with aging. Congenital effects and aging. Therapeutic interventions for cataracts. They've got a no-stitch surgical removal of the lens. There are no post-op restrictions with this type of surgery, and their vision is improved in 1 to 2 days. There are complications that can occur: inflammation, increased intraocular pressure, macular edema, retinal detachment, and vitreous loss. Now, if they have their lens that is diseased with cataracts, if they have that lens removed, then a lens implant is put in its place. Another complication is something called a hyphema, Hyphema. This is a pooling or collecting of blood inside the anterior chamber of the eye, the space between the cornea and the iris. The blood may cover most or all of the iris and the pupil, blocking vision partially or completely. Now, there's something called endophthalmitis. This is inflammation of the interior of the eye. It's possible complication of any intraocular surgery, particularly cataract surgery, and there is a possibility of loss of vision for the eye itself. And another complication, expulsive hemorrhage. This is rare, but it's a dreadful complication of cataract surgery that usually results in either loss of vision or loss of the entire eye. Okay, when we're looking at nursing diagnosis after eye surgery or with eye surgery, think about anxiety again, disturbed sensory perception, deficient knowledge, certainly a risk for infection or risk for injury. Please see page 1251 for interventions. You've got an acronym, What's Up, on table 52.5 for subjective data for patient having eye surgery. Okay, let's talk about macular degeneration. Age-related macular degeneration, or AMD, is the leading cause of visual impairment in the U.S. in residents that are older than 50. It involves deterioration and scarring within the macula, and the macula is the area on the retina where light rays converge for the sharp central vision needed for reading and seeing small objects. The macula is also responsible for our color vision. There are two types. We have dry and wet. In dry, our photoreceptors in the macula fail to function and are not replaced because of advancing age. This is the case in 70 to 90%. Okay? In the wet form, retinal tissue degenerates, allowing vitreous fluid or blood into the subretinal space. New blood vessels form, causing subretinal edema and scarring. This severely limits the central vision. Those at risk include older than 60, those with a family history, those with diabetes, smokers, those frequently exposed again to the UV light, and Caucasian people. Signs and symptoms of these types of macular degeneration. The dry type is slow, progressive loss of central and near vision. With the wet type, it has the same loss of central and near vision, but the onset is sudden and results in more severe vision loss. The Amsler grid is used for self-assessment to identify central vision blind spots. A is normal, B is abnormal. Many times the physician will send these home with the patient so that they can know if there's a problem and they can notify the physician. Therapeutic interventions for the wet type. In the past, they used a laser to seal the leaky blood vessels. Now, the new treatment uses anti-angiogenesis drugs that prevent the formation of new fragile blood vessels that can become leaky. So instead of removing the vessels once they've grown new vessels, they use drugs to prevent the formation of those vessels. With the dry, there is no treatment. Most do not lose peripheral vision, and they don't, but they do become completely blind. And most are considered legally blind with the dry. Prevention, healthful lifestyle that includes dark green leafy vegetables like kale, collards, lettuce, spinach, orange and yellow peppers, yellow corn, colored fruits and veggies, taking retinal carotenoids, lutein, xanthan, and zinc supplements. And there was a study done on certain supplements that are helpful, and it's called the AREDS study, AREDS. And you actually can buy these over the counter. They are supplements all in one pill that help prevent macular degeneration. And my mom's eye doctor actually put her on these. So if you know of someone that has problems or might have problems with their eyes, this AREDS, AREDS supplement is recommended. Nursing diagnosis that go with the macular degeneration. There's also a nursing care plan on page 1245 for patients who have visual impairment of any kind. But for macular degeneration, we have disturbed sensory perception, self-care deficit, risk for injury, risk for impaired home maintenance, interrupted family processes, and ineffective role performance. Okay, moving on to Meniere's disease. This is a balance disorder due to fluid disturbance. The cause is unknown, but it's thought to stem from hypersecretion, hypoabsorption, deficit membrane permeability, allergy, viral infections, hormonal imbalance, or mental stress. Okay, it's usually between the ages of 40 and 60. Symptoms can be mild to severe, and they can be debilitating. The triad of symptoms are also accompanied by nausea and vomiting. And the triad, we have the vertigo, hearing loss, and tinnitus. What is tinnitus? Ringing in the ears. What is vertigo? Dizziness. The attacks may occur suddenly, or they may have signs like headache or fullness in the ears before they start. Tinnitus is present, irritability, depression, and people may withdraw if they have Meniere's disease. The vital signs remain normal. The symptoms usually resolved in several weeks. When the client is in remission until the next acute attack, which usually is 2 to 3 times a year. Eventually, the patient has complete remission with some degree of permanent hearing loss. For acute treatment, tranquilizers, vagal blockers, and bed rest. Okay. With prophylaxis, goals are to reduce symptoms and preserve the hearing. And that would be like restricting salt in their diet so they're not retaining fluid, diuretics, again, to get rid of any retained fluid, antihistamines, vasodilators. They should avoid alcohol, caffeine, and tobacco. Surgical treatment only when these things fail. Complete hearing loss will result with surgery in the affected ear if the labyrinectomy is done. Surgical interventions include a shunt, which may be helpful. Nursing care, we want to manage their symptoms, provide safety in the acute phase. Emotional support is important as the symptoms are unpredictable in nature. Lots of nursing diagnoses go on here. Anxiety, fear, ineffective role performance, impaired social interaction, grieving, risk of injury, deficient fluid volume, imbalanced nutrition less than body requirements, and deficient knowledge. The vertigo alone is pretty devastating in these patients. On page 1267, we have subjective data collection and then a care plan on 1268 that you should look at. Okay, I'll let you look at the review questions. The answer to this one is number 2. 1, 2, 4, and 5 are the answers to this one. Thank you for your attention. I hope you guys will be back on campus soon and we'll be able to continue. Otherwise, we will try to have things videoed and or voiceover and placed online for you to be able to watch. Thank you.